Strabismus is misalignment of the eyes. The eyes are not focused on the same image. And in adults, generally, surgery is necessary to correct the disorder. The surgery is reconstructive, not cosmetic. There is cosmetic benefit, but the main goal is to restore proper visual function. It can eliminate double vision and abnormal head postures. It can expand the field of vision, and it can restore or improve depth perception and 3D vision.
We live in a society where we tell our children, look at me when I'm talking to you. And yet there are people who can't look at you. They drop their heads, they work at night, they stay out of people fields. This is a very important thing that each and every doctor needs to understand who deals with patients who have adult strabismus, because without understanding that, you can't deliver what they need. And they need an understanding physician who has the skills and tools to restore them back or restore them to the way they've never been. And that's crucial in the care of the adult strabismic.
Suddenly my wife started asking if I was tired all the time. And I wasn't any more tired. It was just that my eye had drifted. And it was a sign to her that maybe I just wasn't as strong a guy as I used to be.
I don't like to take pictures. Whenever I'm in a social environment, whenever I'm talking to someone, they look the other way or they look down as if they don't want to actually stare at my eye, or I may be talking to one person and I have two different people asking, am I talking to them? I'm not married, I am single. A lot of that, whenever I don't really want to interact with people, because if I talk to a guy or anyone, just, when most people, they like you to make eye contact with them, and I'm always afraid to make eye contact because my eyes are not looking straight. If I meet a guy, I'm not for sure if he maybe will be interested in taking me out, because, people will be looking at me, force my eyes. So it could have a great effect on why, a guy wouldn't take me out, and which would play a big part of it. Because I don't think, someone would want to take someone out when they, I think it would be hard, a child to take someone out when, he introducing people and they're being able to look at my eye.
Told nothing could be done, or they would see double, or the friends told them they saw double after eye muscle surgery. But we find that it's very rarely the case. Unfortunately, the optometrists who don't do surgery often will warn people against surgery. They're much more afraid than they have to be. It's so amazing to see after the surgery and have the patient say, well, if I had known it was going to be this easy, I would have done it long ago.
Hello everyone, I'm back, and it's been 3 months and I am so excited. I'm gonna cry, but everything has just been going great. Now my confidence is back up. I'm able to talk to people, just be able to look at them in the eye and having that contact. Normally, when I used to talk to people, I used to look down, look up, but now I'm able to just talk to them and feel confident because we're now making that eye contact.
In the course of my practice, I've cared for quite a large number of adults with strabismus. And one of the things that continues to surprise me and I guess distress me is what a large percentage of these patients have had to live with this problem for many years, and they're under the misconception or they had been under the misconception that nothing could be done.
I visited about 10 to 12 optometrists in my lifetime, and it was not until I was 51 years old that I went to an eye doctor, an optometrist here in Dallas, Texas area, and she referred me.
And I've been to numerous doctors over the years, specialists in the field of ophthalmic surgery, or however you say it, but I've always been told that there's nothing they can do for me.
I think that this
this operation that I had, this procedure, is the greatest thing that's happened to me in quite a few years. If you have the opportunity to get some corrections done to your vision, then please don't wait. The technology out there has changed so much over the years that there is help for everyone.
Many of these patients had been under the care of primary care physicians, comprehensive ophthalmologists, or optometrists for years, who examine them year after year and never tell them that something can be done. And they're both surprised pleasantly to know that something can be done, something that's highly effective and quite safe. And often they express distress and displeasure over the fact that they were never told that something can be done.
There are persons who come to us and to others who do what we do, and they have misaligned eyes, and it's affected their lives in rather profound ways. It has affected the way they interact with people. These eyes of ours are communication devices as well as the front receiving end of our brains, and so they fundamentally affect our personhood. They affect who we are and how we relate to others.
By adjusting surgically the position and length of the eye muscles, we realign the eyes. And when we realign the eyes, the visual feedback circuits of the brain can relearn. The brain relearns to use the two eyes together as nature intended.
It's a source of emotion for me. My eyes have been, as they get worse, it's self-consciousness, but not in a vain way. It's a source of, they're your eyes, and you feel very, very, something you need. And when you see something occur constantly, I think it builds a sense of fear, but it also is, it hits your self-esteem.
When you can't look a man in the eye when you're trying to discuss like a job interview, it's my depth perception, balance has been affected. I can't do things like swing a hammer. I'm walking into walls. I'm all cut up because I'm bumping stuff all the time. I just can't imagine that something like this could come on, so suddenly. Actually, it's probably been going on 7 or 8 years, but, I really don't know what brought it on, but I'm telling you, it's just, it's the worst thing that's ever happened to me.
It doesn't matter what age you are, whether you are the 15-year-old girl who's devastated going to middle school or high school, or the 85-year-old woman who's devastated in her social group, or the 90-year-old priest that I helped. In every way, this impacts the way you interact with people. The eyes are the windows to our soul, and that is not just a phrase that's used so simply. People believe that, and if you don't look normal, and there's only one normal way to look with your eyes, and that's orthophoric or straight-eyed. Everything else is abnormal. So this is not a cosmetic issue. Cosmetic is improving or enhancing normal. This is reconstructive or restorative back to normal appearance. And it's a heck of a thing to go through your life not appearing normal. So the physician needs to be aware of these issues as they're taking care of the patient with adult strabismus.
My life has changed tremendously from this. And you don't know how it actually feels unless you're the patient. It's a life-changing experience for the better. I was so appreciative that she sent me to have this corrected that I brought a dozen roses. I've been bringing her Louisiana foods ever since, and we've become friends. I'd like for you guys to know that you don't lose a patient when you send a patient to get help. You gain a patient. As a matter of fact, Dr. Vu has gotten over a dozen referrals from me since she has helped me.
For more information, please visit www.aapos.org.